Hello, everybody, and welcome back to the Patient First podcast. I am so glad that you're here. As I like to do oftentimes here on the Patient First podcast, is discuss articles or studies or what we like to call key KDIs, the key dental indicators, metrics that are going on in dentistry that I thought you should know about. And today we're talking about a study, a survey that was done by Byte, which is an orthodontic company, in June of about 1,107, or exactly 1,107 people. And they came to four insights as to why people delay dental care. And think about that for a little bit. Just, why you think that, why do people delay dental care? And this, I believe the results are probably skewed to show some to make a point, but the fact remains that valid, that this Byte survey showed that in this survey, there were four major insights. Number one was that 17% of respondents experienced difficulty at getting a dental appointment. So 17% of people, about one in five, said they had difficulty getting a dental appointment. 30% of people waited 1 month or longer for a dental appointment. Think about that for a second. About one in three people waited a month or longer. Can you think of anything that you've waited a month for or longer in your life right now? Well, 30% of these 1,100 people had to wait that long for a dental appointment. 20% put off going to the dentist because of scheduling issues. So, of the people that they responded, 20% of them, one in five, actually put it off because of scheduling, and 18% delayed receiving an oral care health issue, getting treatment because of scheduling. So it's about the same, right? 20%. So overall, people have trouble getting dental appointments today. About somewhere between one in five and one in three. So what does that mean? Well, I talk to dentists all the time. I just talked with a great dentist yesterday who's looking at growing his practice and then potentially merging with a large group or exiting his practice in about 2 to 3 years. And everybody tells me the same thing to some degree or another. With very rare exception, people are looking for more new patients, right? Does that sound familiar? I can tell you, if I want to have people get to an event, if I talk about getting more new patients, that's probably the best way to attract dentists. Lots of people are looking to increase their production, right? But patients can't even get into our offices. And this is really, really painful for me because I'm hearing this about my own office. We're at about 98% capacity. And I might have, if you've been listening to the podcast, we're actually expanding the practice now. So this is a crucial issue for me because I've expanded my practice. God, I don't even know how many times we ended up buying practices to get extra, So as things have grown, we've had to keep expanding things because this has been such a big issue. However, we also haven't had to really think about getting more new patients. We really have to evaluate what's going on in our practices. If you're looking for more new patients, which is the lifeblood of any new practice, of any practice, so I definitely don't want to discount you looking at attracting more new patients, at having higher production, but check the capacity of what you're using today. Have you maximized it? Do people have to wait a month to get into your practice? That is a problem that should be fixed first, right? Like I said, that's what's going on in my own practice right now. And I know it's hurting new patients, it's hurting our production, but we have to expand because we're actually beyond capacity, frankly. And getting even my own teeth cleaned can be very, very difficult. So I think a lot of us are in that situation. So what can you do about it? Well, I think looking at your physical space, and who you have working there, is it optimized? Organizing your office to maintain optimal patient flow. That's a big one. Just looking at the workflow and seeing what can be optimized. A second thing that I would recommend that you do is look at automating whatever you can. A lot of what we do today in our practices just takes too much time and it can be automated. Obviously, figuring paperwork for patients, they should be on your website. You should be able to text or email it to patients. Billing should be done outside of your practice, right? It should all be automated. If you need help with automating or organizing your practice, check out toothapps.com. We've got some great tools to help offload work and time from your team so you can open up capacity at your practice. Also, systemizing whatever you can. I can't stress that enough. If every time you do a procedure or every time you bring in a patient to do something, if you have to look at it every time and reinvent it, it's going to take you twice as long or more to do it. I mean, I think of like, think about the last home improvement project you did. If it was the first time you did it, it probably would take you 10 times longer than if you had done that project 10 times before. If you've never painted a room before, that first time takes so long. But if you've painted a bunch, if you watch a painter or a mover, they just make it happen. And we need to systemize our offices so that we can be more efficient, because patients are out there looking for the appointments, your own patients today, and they're not going to wait around a month for an appointment, right? So systematize your practice as much as possible, automate and organize your office for flow. Now, I've done an entire course about this called The Insanely Productive Dentist over at Upgrade Dental, which you can get. You can try it out for only $1. Just go to upgradedental.com/VIP and you can try out our mentor level membership plan where you get IPD included. You can try it out for $1, like I said. So if you are one of those offices, one of the many offices that has somewhere between 1/3 and 1 in 5 of your patients who are having trouble getting in to see you, please look at automating, systematizing your practice, organizing your office flow so that you can get people the care that they deserve, increase your production. And oftentimes we don't even need to start with getting more new patients. It starts with being able to be available, convenient for the patients that are already in our practices. So learn more, go to upgradedental.com/VIP. Thank you very much. And I look forward to talking with you next week right here on the Patient First podcast. And of course, putting patients first means first seeing your patient. So be available as much as you can. If you're having trouble, get together with your team, look at ways to optimize your workflow, and check out Upgrade Dental. Thank you very much. See you next week.